The CDC clarifying its guidance on isolation and quarantine protocols amidst growing pushback of recent changes. You'll remember last week the agency shortened the recommended period of isolation but did not include a testing component. Well, Mike Valente walks us through how that guidance has evolved and what this means for you. That's the LEX 18 Big Story at 11.
Over the holidays, with employees on vacation and Omicron continuing to exacerbate staffing shortages, the CDC announced that people diagnosed with COVID-19 could leave isolation after 5 days if their symptoms had resolved and they wear a mask around others for an additional 5 days. In explaining the change, the CDC cited data that indicated the majority of transmission occurs during the early periods of infection, as well as citing the impact the pandemic has had on critical infrastructure and staffing shortages.
By the time 5 days of isolation has occurred, you probably have about 85 to 90% of all of your transmission potential behind you while you've been in isolation.
Absent from the updated guidance was a testing component. Outside public health experts and state officials argued that a negative test should be required to leave isolation.
If it were me, or my family want to test negative at least twice.
On Tuesday, the CDC clarified some of the language in its guidance, but did not add a testing requirement. Instead, it noted that if you do have access to a test, you should take one towards the end of the 5-day isolation period.
They are just continuing to assess every day, every week, what information they can update on based on the science. And sometimes that means changing recommendations, that means adding to recommendations, but that's what happens when you lead with the data and the science and not lead with a clear communications plan.
But it's the communication with the CDC, or rather lack of it, that Governor Andy Beshear honed in on during his COVID-19 briefing Monday. When we asked him about there not being a testing requirement, the governor said he would have appreciated a more collaborative process in finalizing the shortened isolation guidance.
We would have liked to have had more input. We would have liked to have done more analysis. I'm not sure we agree with every piece that is on it.
Beshear did, however, make it a point to say he believes the CDC is trying to do its best. Mike Valente, LEX 18 News.